We have commenced the assessment. This program does have an element of equipment replacement or upgrades, but on a more broader national level, we are now exploring an approach that will see us equipping our health infrastructure with the appropriate equipment, either through partnerships, through leasing arrangements, or otherwise, so that when a patient, to come back to the patient, goes to a hospital with a symptom, they don't have to wait 3, 4 or more extra days or find the money themselves to go to find out based on a diagnosis assumption that is made because they don't have the hospital that is a CT scan or an X-ray machine. We need to end that period in our history. It is important. So we are going to be making some announcements about that in short order. The third, of course, are the people. And this is where I would like to close, because at the end of the day, our health system and the approach to making it responsive and resilient has largely been about the commitment, the work, the talent, the capacity of our people, our nurses, our doctors, our administrators, and they have risen to the occasion time and time again. You have risen to the occasion time and time again. And oftentimes it's been difficult because you have not had the environment that supports the work, you know, the working environment, the working conditions, the equipment that's supposed to support the work. You do have the training. I think Jamaican healthcare professionals are some of the best in the world, and I believe the world confirms that with the high demand that they place in recruiting them. But it's only, we are also embarking on a program to right-size our infrastructure, to see how many more doctors we need, how many more nurses, what is required at the primary level, what is required at the secondary level. And the intention there is to ensure that in parallel with the build-out and the equipping of diagnostics, we have the people to man the systems. And so, if we find the formula around infrastructure, equipment, and people, then I believe that Jamaica will place itself in a position to respond to the needs of the Jamaican people as it relates to healthcare. Like I said, this is an ambitious program, but it's a program that is long overdue. And indeed, the Jamaican people deserve it. And this government is committed to it. I am committed to it, and the team at the ministry are committed to it. I close today on 2 fronts. Firstly, by thanking all those who have played a critical role in bringing us to this point. The top tier leadership of the ministry, the Office of the Permanent Secretary, Office of the Chief Medical Officer, the unit heads, the regional heads. It really has had to have been a collaborative effort. The external stakeholders, the architects who are here, I see GW here, and others, the multilateral partners, the IDB, bilateral partners, others. We have had to pull all together to get everyone around a common vision, common belief that this is possible, and to define a role for all, and coordinated the efforts to bring us to where we are today. And it didn't take one person or just one set of persons, it took all of us. And I really want to place on record my absolute appreciation for us to get to this point. We know we still have some ways to go, but I did commit to myself that we will celebrate small achievements, celebrate small steps, because it encourages and motivates us to go to the next step. And I believe that today is justified given the efforts that have gone into the last few years. I want to say to the Jamaican people, while we do not encourage you by building out this infrastructure to want to be in the hospital, so don't take me seriously with what I said earlier when I just started, because this is never the solution. We can never build enough hospital beds and operating theaters for irresponsible behavior. And I think that is a very important note to mention and emphasize. It's all about how you treat yourself, how you interact with your environment, your lifestyle. We want longevity of life and quality of life. And so it really starts with taking care of yourself. And this is why this program is important, because it has a primary component to it. We're working on a remodeling of our primary outreach, primary infrastructure program and services. The CMO is doing that. We'll unveil that soon. And we want to encourage communities, families and individuals. Eat healthy, exercise, get your rest, find ways to relax, and minimize the need for you to come into a hospital to require care. However, having said that, if you do require that care, we want you to be rest assured that we have the people, we have the equipment, and we have the infrastructure. We'll be here all day today until 6 or 7, I think. And so we encourage you to look, learn, listen, and share the vision with us and share it with others so that we can together move forward to build out a better health system. Thank you very much.
We just want to thank you, Minister Tufton, for that detailed address. Take off my mask. Yes.
Sorry.
We want to thank you for that detailed address. We thank you so much for your support on this project. You are a true leader, a true visionary, and we're so looking forward to the minister leading us into a resilient health system. At this time, we're at the close of our ceremony. I want to take the opportunity to just recognize the Honorable Colonel Charles Jr., who is with us. He's a member of Parliament for Southeastern Carindon. We want to thank you so much for coming out and supporting us, Minister. And we're just going to officially open our exhibition. Before I do that, I want to just extend